since I become a supervisor, and one of my nurses, she was on the phone with a diabetic patient, and the diabetic patient was talking to her and lost consciousness. So she could hear her breathing, but she was not responding. So the nurse messaged me that this was going on. Well, I called 911, and that takes a little bit when you're trying to get it out of the state. And another supervisor was calling the practice, and another supervisor was trying to contact her sons. Meanwhile, the nurse was staying on the phone, listening to the patient breathe and trying to get her response. We could not get a hold of the patient's sons. We did get a hold of the practice and notify them. 911 sent somebody in. We couldn't get anybody to open the door, of course, because she was unresponsive. So they had to knock down the door. And when they finally got to her and the nurse was able to convey the whole story to the EMS, then they took her on to the hospital. And we found out later when we called to check on her that she had been in the ICU for 2 weeks to get her blood sugar regulated. And then another week on the floor at the hospital before she was allowed to go to rehab. So if we had not been on the phone with her at that time, that patient would have most likely passed away and nobody would have known. The sons did get in touch with us later and thanked us profusely. I believe they sent a card too, because they made it to the hospital in time to see her in ICU. But this story is just like the epitome of what Wellbox can do for patients that do not have anybody at home and don't have anybody checking on them, every day or once in a while to remind them that they need to keep taking their medications as prescribed.